my background as a player, I played high school football. I played 1 year before high school. I played 4 years of high school football. I played 4 years of college football at Princeton University, all offensive line. Academic training. I have a PhD in anatomy and neurobiology from the University of California, Irvine. I've been a secondary teacher for 10 years, and prior to that was a neuroscience professional in the University of California system. Is that enough about me? Yeah. Okay, what makes one person more aggressive than another is a very interesting question. Recently, there's a study that found a gene, they call it the rage gene. I just found this yesterday. The rage gene, and so there is a suggestion that we are genetically predisposed to be more aggressive or less aggressive. So there is that, a predisposition that's biological. Furthermore, biologically, our response to the male hormone testosterone and its prevalence in our bloodstream has a lot to do with rage and aggression. And then finally, how we're trained. You can make a very passive individual into an aggressive individual by training them in certain ways, some more controversial than others. What is a concussion? A concussion is a brain injury, and there are many different grades or many different grades of concussion, ranging from the least serious, which has symptoms like headache and light sensitivity, to the most serious, which puts an individual's life in danger. As a concussion grade gets worse, the symptoms are more serious and are a result of brain injury like bleeding in the brain, which then of course could eventually cause death. Changes in blood pressure could affect the concussion, or the patient with the concussion, and depending on the grade of concussion, the individual is actually told either not to go to sleep that evening, or they have somebody with them when they sleep, just to make sure that they don't stop breathing from a lack of blood pressure. Concussions are shock injuries, blunt force trauma. It's not just in football, any kind of contact sport, any type of fall where the head is struck by something hard. In football and say collision sports of boxing and mixed martial arts, a hit to the posterior jaw area, right around the ear, is the most common place for a concussion to result from such a blow. And the reason for that is a very sensitive part of the brain called the hippocampus is directly underneath that part of the brain, or that part of the skull, excuse me. And when that gets jarred, you get retrograde and anterograde amnesia, meaning you don't remember what happened right around the event itself. Don't remember exactly what you were doing before you got hit, and how you got to where you were now after the hit. And that's a hippocampus injury. What else can I say about concussion? Long-term effects, side effects of concussion. Headaches. The longer headaches last, the worse off you are in terms of grading the concussion. A lot of times it's a wait-and-see type of course of action from a doctor's standpoint. In other words, wait and see how you feel tomorrow and the next day, and you have to be symptom-free for a certain amount of days before you can re-engage in physical activity. Light sensitivity, nausea immediately around the hit. Hey, boss.
I would like to swab your turtle for bacteria.
Go for it.
I want to comment